Silk Road Medical introduces the TCAR procedure, Transcarotid Artery Revascularization. The TCAR procedure is a clinically proven, less invasive alternative to carotid endarterectomy. Carotid artery disease is one of the leading causes of stroke. Plaque that builds up in the arteries can occlude blood flow to the brain. But current treatment options present challenges of their own. Surgery or carotid endarterectomy is quite invasive and can lead to complications in patients at risk for an open surgical procedure. The minimally invasive alternative, carotid artery stenting from an access point in the leg, carries an increased risk of stroke during the procedure itself. The TCAR procedure, Transcarotid Artery Revascularization, from Silk Road Medical, offers a clinically proven, minimally invasive alternative to surgery. The TCAR procedure uses a stent and is inspired by surgical principles for protecting the brain. TCAR uses direct access to the carotid artery and an advanced system for temporarily reversing blood flow during device delivery. The TCAR procedure begins with a small incision just above the collarbone to expose the carotid artery. A vessel loop is placed to control and clamp the artery during the procedure, and a suture is placed for easy closure of the puncture site at the end of the case. A specialized sheath is placed through a small puncture in the common carotid artery. This sheath will be used to deliver a stent. But first, it will temporarily reverse blood flow in the artery. Flow reversal keeps debris moving away from the brain, protecting it from dangerous emboli. The sheath is connected to a circuit outside the body that directs the blood flow into the femoral vein. The connection between the high-pressure arterial system in the brain and the low-pressure vein in the leg creates a pressure gradient, causing blood to move backwards in the carotid artery. Clinical studies have shown this temporary redirection of blood flow is not problematic because the brain is fed by multiple arteries, which maintain cerebral blood flow throughout the procedure. The en route transcarotid neuroprotection system provides operator control over the blood flow rate throughout the procedure. With flow reversal established, the conformable en route transcarotid stent is placed to stabilize the plaque against the wall of the artery and minimize the potential for a future stroke. Balloon catheters can also be used to further expand the stent when appropriate. The delivery of these therapeutic devices can disrupt the plaque, causing dangerous debris to come loose. The en route transcarotid neuroprotection system is designed to capture and filter that debris throughout the procedure to prevent a procedural stroke. Once the stent is placed, the clamp is loosened and the sheath can be removed so that blood resumes its normal path to the brain. The vessel is closed using the sutures placed earlier. The Silk Road Medical TCAR procedure, Transcarotid Artery Revascularization, a clinically proven, less invasive alternative to carotid endarterectomy.